Wonderful. Well, I will share my slides, and I'm eager to hear your questions and thoughts and feedback at the end of the presentation. Let me see if I can share screen. Hmm, Okay. Is everyone able to see?
Hmm.
All right. So tonight I'm going to share a bit about kind of how I came into this work and a bit of background on what the Planetary Health Report Card Initiative is and how I'm working on a project to develop an adapted report card for graduate medical trainees to use in advocacy. And I like to start just by sharing a little bit about how I came to this work. I have no conflicts of interest. I am getting a little bit of funding from my residency program to do my project. Um, so I came to climate organizing actually through my interest in global health equity and kind of experiences over the past decade of kind of sustained collaboration with some folks in India on palliative care access. And I had this really amazing experience in 2017 of working with the organization Pallium India in the South Indian state of Kerala, and going on home visits with interdisciplinary teams that were providing really just beautiful care to folks who needed palliative care in their community and kind of really addressing health inequities in their community in a beautiful way. And then, as some of you may know, the following summer in 2018, there was extensive flooding throughout the state of Kerala that displaced about 1 million people and really impacted many of the communities where this work was happening. And so that led me to start reading a lot of news. It was hard, being far away and looking at that news and then learning how climate change was increasing the frequency and severity of events like this. And so this is a map from an article published in The Lancet on health impacts of climate change. And the map on the top, map A, shows the relative proportion of cumulative carbon emissions emitted by different countries over time. And so the arrow is pointing to California and the United States contributing disproportionately to this problem. And then the other red arrow, is pointing to the west coast of India where Kerala is located. And as you can see in map B, the severity, the consequences for climate change. And this is just on a few specific health indicators that are climate impacted, such as malaria burden, malnutrition, diarrheal disease, so disproportionately affecting Africa, South Asia, Southeast Asia. And so this really struck me as, deeply unfair. And that is how I got really passionate about addressing climate change. And then it hit home with the Paradise fires that happened in 2018 in the fall, with the sky turning this color in San Francisco, and just really feeling the urgency, while I was in my medical training to figure out what could I do as a medical student on this issue. And the first thing I did was actually join the Sunrise Movement. So at that time, they were starting their, protest actions. And I was very inspired by the response they were getting in Congress. And then I tried to find a way to bridge that kind of energy and sense of community with the medical community, because I was meeting more medical students and more doctors who were really concerned about climate change, but looking for outlets for that concern. And so I got involved in starting Climate Health Now in California with Margie, and then Medical
Yeah.
Students for a Sustainable Future with a large network of medical students all around the US. We initially met on Twitter and through the Physician Network of Healthcare Without Harm, and then started to get more organized from there. And I wanted to name that a really important source of inspiration for this kind of organizing in climate and health equity, um, at least for me, and I think a number of my peers in the medical student space, has come from the White Coats for Black Lives organization. UCSF was also one of the sites of organizing for this, in solidarity with the Black Lives Matter movement when they initially formed in 2014. And so I think we really have learned a lot from their tactics and approach to bringing medical support and allyship to social movements. And one of their tactics was developing a report card. So the racial justice report card of White Coats for Black Lives laid out this really amazing, detailed set of metrics on what are the goals that we want to advance in our institutions as medical students and trainees to make our institutions more equitable and anti-racist. And so these are the report card kind of domains that they look at. They address representation, recruitment, leadership, grade disparities, campus policing, treatment of staff, lots of important domains. And this was all developed by medical students. And so, really inspired by those efforts, there was a group of medical students at UCSF in 2019 who began to work on a planetary health report card, using a structured tool to support student advocacy with university leadership. And they went through an iterative process of kind of outlining different domains and metrics that would be important to advocate for. And then they had those metrics reviewed by experts in climate and health curriculum and sustainability, and then published a pilot of the report card in 2020. And the initial participating medical schools are listed here. And I wanted to show you the 5 core domains of the Planetary Health Report Card. So the first is Planetary Health Curriculum. The second is interdisciplinary research in health and the environment. Next is community outreach and advocacy, and then support for student-led planetary health initiatives. And those were the initial 4 domains in the first pilot year. And then in the second year, a domain was added focused on campus sustainability. So this did not cover an extensive review of the hospitals affiliated with the medical school, but was rather focused on the medical school campus itself and the buildings and transportation, the various scopes of emissions that are within the campus domain. And so the metrics within each domain get quite detailed, but I wanted to just give you a sense of what is included. So one example here is from domain 1, so curriculum. Does your medical school curriculum address the relationship between extreme temperature health risks and climate change? And then there's a point scale. So schools will earn points based on whether the topic is covered in core or elective curriculum and how in-depth. And so students, form a team and actually review the curriculum, reach out and talk to course directors, look extensively at their university websites and basically come up with scores for their institution. The next example here is in the campus sustainability domain, and asks, how ambitious is your school's plan to reduce its own carbon footprint? And so here you can see the points earned would be based on the degree of ambition in when they pledge to achieve carbon neutrality, how realistic the plan is to achieve that. And I'm really proud of the students who launched this initiative. Carly Hampshire, the lead author here, has really built a beautiful collaborative community around this report card that has really flourished around the world. So last year they published a brief article in the Lancet Planetary Health, and I'm happy to share the link. I encourage you to read it if you want to learn more about, how the initiative has launched and grown. But this is a map that shows the locations of schools that participated in the second year of the report card initiative. So once sustainability was also included. So schools in Ireland, the UK, Malaysia, and the US and Canada participated. And now there are students in 13 countries participating. The report card has been translated into multiple languages. And students in nursing, pharmacy, and physiotherapy have contacted the PHRC team and ultimately have adapted the metrics to be suited to their type of training, and are now producing report cards that are viewable on the PHRC website. And maybe before I go to this, I will say one of the limitations of the report card initiative is that it's been mainly driven by student passion, and there has not been a great deal of research in terms of what the impact of the report card has been, or adapting the metrics. How do we know that these are the most impactful metrics for students to be grading their institutions on? And yet, despite those limitations, it's had such a broad spread and impact because of the passion of the students engaged in this work and their mentors. But something that has been a missed opportunity is engaging and providing opportunities for graduate medical trainees to be involved in this activism. And I think some of the unique challenges for residents and fellows to be involved includes that every specialty may need its own curriculum and learning objectives, whereas at the undergraduate level, there is a core curriculum, and it's possible for medical students and faculty all around the country to collaborate and develop competencies that are appropriate for an undergraduate medical level of training. Once you get to the graduate level, there's such a profusion of specialties and programs. And then in addition, there are, as we know, severe time constraints on residents and also fellows due to their clinical workload. And so it can be daunting to think about having significant extracurricular projects during this specific time period. And yet, there's good evidence that having graduate medical trainees engaged in this work can make an important difference. The AAMC recently published this report on climate action in academic medicine, and they surveyed medical school deans as well as health system CEOs of academically affiliated health systems on climate mitigation, resilience, and on curriculum in their institutions. And one of the key findings in this report was that they are influenced by the views of their trainees, and they have heard loud and clear that trainees need the institutions to be working on these issues. And CEOs mentioned issues of trainee and young faculty recruitment and retention. And so I think there is a sense that progress can be driven by trainees in these roles. And then some other reasons why, this is a special time period to be engaged in climate activism is you're much more embedded in a clinical setting for many hours a week. So you're seeing up close the climate impacts on patients and also issues like medical waste and processes in the organization that could be adapted to make them more aligned with planetary health. So it's a prime, time to learn about resources like Practice Green Health or different organizations that provide frameworks for improving sustainability. It's also a time when, for example, the Office of Climate Change and Health Equity has been established and issued the HHS Health Sector Climate Pledge. And so more and more academic health systems and community health systems are signing on to pledges like this or could be pressured to sign on to pledges like this. And then there's also growing interest in developing learning objectives and competency-based curriculum for graduate level trainees. And so this paper was published in Academic Medicine by a team of wonderful folks working on that. And I got lucky. This is my program director, Dr. Aisha Barber at Children's National. She has become a mentor to me on my project because she actually recognized the racial justice report card as a powerful tool that trainees were using. And she has been working over the past few years to adapt that to graduate medical training programs. So this is one of her publications on that work. And so she's been able to mentor me now on developing a report card adapted for graduate medical trainees. And so the approach that we've taken is to adapt the metrics that already exist. The students did a lot of work, literature reviews, developing these domains and metrics. And so we are simply looking to adapt them and to do this through a survey of content experts, including current graduate trainees who, have the expertise of their own training experience, and then current faculty and GME programs who have a passion or commitment in this area. And then I just wanted to show you the core domains again. There are a couple domains where I did an additional literature review because after discussing with the PHRC team, it seemed really clear that the difference between undergraduate and graduate medical education was going to be significant enough that we would need to do a first line round of metric adaptation. And so for the curriculum domain, we did that because of the issue I mentioned earlier of the vast specialty variation in curriculum needs, and then also the campus sustainability domain. I did a literature review because we really want to include hospital sustainability since trainees are so embedded in their hospitals and can then have more of an impact on sustainability at a larger level. And so far we've recruited 46 eligible participants, and we did that through purposive and snowball sampling, so reaching out purposefully to different networks and communities of folks who would be eligible and interested, and then also encouraging them to share the call with their networks of leaders in planetary health and GME. And then the method that we're using is something called a Delphi panel methodology, which is something that's been used a lot in medical education to develop learning objectives, to develop curriculum. It's a way of reaching expert consensus on a set of metrics, basically. And so the first step is polling folks individually about their views on each metric, and then tabulating the results, and then feeding them back to the participants at least once. So doing multiple rounds where folks get to read and reflect on the feedback of their colleagues and then decide if they truly agree or disagree that a metric should be included. And so that's sort of an overview of the project that I've been working on. I want to leave plenty of time for conversation. So I just wanted to thank Dr. Barber, my mentor, and the members of the Planetary Health Report Card team who I've worked with most closely on this, Carly, Taylor, and Isabel. And then I wanted to thank Dr. Phillips-Bourne and Dr. Aparna Bol, who provided mentorship and kind of early conversations in the conceptualization of this project, and Dr. Collins and Dr. Byron, who helped with distributing the intake form for the survey and my funding source. And then these are my email addresses if you want to reach out or have any questions in the future.
That was amazing.
Thanks, Laura.
Maybe question number one, how can us old guys help out?
Oh my goodness, there are so many ways to help out. We're still in round one of the survey. And so if you are someone who teaches or is affiliated with a residency program or a fellowship program and you would like to participate, I can send you the intake link to sign up. And yeah, then just mentoring and advocating as you do.
So if we're not, if people here aren't faculty that maybe had previously been faculty to where they still have contacts, in schools in their area, that's a possibility. Is that correct?
Yeah, if you immediately have a colleague who's coming to mind who you think would be a good person to take the survey, I will share with you the link. I'm just going to unshare my screen so I can pop that in the chat.
I just want to say that, boy, it just gives me so much hope to hear about the passion that you guys are displaying and how effective you are, and the fact that that your mentors or the people are listening to you and responding to you. It just gives me a lot of hope, and I'm grateful to you for your leadership.
I have to admit, I was amazed a few years ago to first hear this statistic that, that medical schools are actually much more likely to incorporate climate if students ask as opposed to if faculty ask, which is amazing. And everybody seems to confirm that. So that's pretty amazing.
And I'll say it's been really important for students to have supportive faculty mentors. Like the PHRC wouldn't have launched without Catherine Gundling, without the faculty who gave their feedback and gave their backing. So it's definitely it's strategy too, like figuring out how do we have that multi-generational collaboration in order to get where we need to go. Hi, Robin.
Hi, Sarah.
Great
It's
to
so
see
good to
you.
see you here, and you're so far away.
I know.
I just want to congratulate you on your presentation tonight and on your project, and also what your acknowledgement also for your faculty advisor, Catherine Gundling. For those of you who are not UCS embedded, she's quite extraordinary here at the University of California, San Francisco, and has been the person supporting these extraordinary students, Sarah, Carly, and many others. I also thought that Lisa, not just their passion, but as you can tell, incredible depth of looking at material in a very, very specific way. And I've known about the report card, but to see just the depth of what you've had to look at just blows me away. I also appreciate your comment about having very little metrics or ways to measure the impact that this very big report is. And I know that for me personally, I can start something with great fervor and then don't know if it's made a difference. And I think figuring out that is a really complex thing, and wonder about that. If you have any thoughts about how one might go about that, I would be very interested. And also the ways that you're seeing this particular project being moving ahead.
Thank you, Robin. So the undergraduate report card has now been ongoing for multiple years. And so something they do have is evidence of change in the scores that institutions get year to year. And along with the scoring, there are qualitative comments from the students on, why did the school earn this score and what has changed? And so the article that they published in the Lancet Planetary Health does include a table that kind of summarizes some of the changes that were noted in different places. And so they do have a growing body of evidence, I think, of the impact of the report card at specific institutions. But then looking more kind of globally at changes in academic medicine, it was nice to get the AAMC's report kind of providing some more of that data. And I'm sure that there are other ways to look at it too. But those are some initial steps.
Maybe about 5 minutes more here. Cynthia?
Hi, Cynthia. Oh, you're muted.
Thank you. Hi, Sarah. Great to see you again. It's such a privilege to be associated with all of you fabulous students and now trainees who are driving this work forward. And you are going to save us. And we want to be on board to help as much as we can. And I can't help but thinking about all of the work that's been done on social tipping points. And so it's interesting that we think that the health message is crucial. And what you guys are doing is helping to shape the health message, getting the whole health system on board with that, which is huge. So one thing that I learned tonight was how this originated with the White Coats for Black Lives Matter, which is very, very interesting because we see so much of this is coming down to health equity and environmental justice, which ties in so directly to that. It's all of a piece. And I just wanted to mention what we're doing in Voting for Climate and Health, which is trying to address that, to bring advocacy regarding health equity into action, which is helping the patients help themselves and really drive change. And we're hoping to get that into the PHRC, actually.
That's wonderful. Yeah, Cynthia, I'd love to hear more about your thoughts on incorporating that. Yeah, there's incredible work around voter registration and empowering patients to vote. And yeah, I really appreciate that.
Yeah, I hope we'll have a chance to work more on that, and with Margie as well, who you'll hear more from.
Thanks. Shweta and then Rob.
Yeah, I'll be really quick. Sarah, that was great presentation, very inspiring, as everybody else has said. It's always inspiring to hear what people are doing. Yeah, I've never heard of this project before, so it's really, really interesting how it all came together, and loved your story. One brought up in India, I kind of know how unequal the impacts are in certain places. But my question is like, when you and your team kind of came about this project, what was your end goal in mind? Like, were you thinking that this kind of report card will at one time go kind of, you publicly rank institutions, or was that to kind of pressure these schools to be better at sustainability, be better at incorporating climate health and equity on these metrics? So what was your overarching goal for this report card?
Thank you. I think, and I can't totally speak to the motivations of each person who was involved in launching the initiative, but I think there were multiple goals. I mean, ultimately, the big goal was to drive change in our institutions and to push them to provide us as trainees with the curriculum that we need to be physicians in this changing climate, and to provide us with research opportunities, support for things that we wanted to engage in, and to be better stewards in the community and more sustainable. And I think at the same time, we didn't want to totally dishearten institutions that were really not there yet. And so there was some great inflation involved, I would say. So like an 80% score is an A, and I don't think any institution got an A. So yeah, there was some consideration of, we want this to be a tool that promotes collaboration with the leadership at our institutions as well. It's naturally going to apply some pressure and maybe cause some embarrassment. But we want it to be a tool for positive change. Yeah.
Rob?
And Sarah, wonderful job. And as we all are tied to double-blind placebo-controlled trials and that level of evidence, I think it's also worth pointing out of how much impact you and the others with the Planetary scorecard have had. I mean, it's expanded to other disciplines like pharmacy and others. And even in the absence of evidence, that's huge, especially now. So it really is having an impact, and don't discount that.
Thank you so much, Rob.
Well, thanks so much. You guys have her email in the chat if you have a further question that comes to mind, and give her some grace as to how long it takes to answer, given where she is in her training right now. And just everybody, yeah, thanks a million.
Before
that
you
was
go,
great.
Sarah, I have a very specific personal question in the chat for you. So anyway,
Thanks, Robin. I saw that. Yeah, I actually don't know where he is now, but I bet that Carly would know.
we
Yeah.
won't take everybody else's
Sure.
attention. Searching for lost souls.
And Margie, thanks for your comment. That's incredible. I'd love to talk with you.
Okay, well, you're
Thank you
welcome
all
to
for having
go
me.
and have 20 minutes of your evening back, but you're also welcome to stay. Guys, I feel like we haven't done the best of job engaging the people who sign up for the health team. There's about 400, I think, now on the health team list. And we just had a lovely meeting the other day between Lisa and Rob and I, and Shweta, who works with the American Public Health Association and has one of those brains that thinks about big pictures, and she had lovely questions for all of us. And so we're going to dedicate the January session to talking about this, but we thought we would sort of start getting some ideas tonight. Basically looking at maybe having various people look at different aspects of climate and health that we could be working on, such as, having an op-ed team, which doesn't mean they do all the writing, but they work on it, or they find people to write things, having a team that does outreach to medical organizations, which a number of us have done in the past, but I don't think too many of us have done too much recently. Yeah, Shweta, would you like to talk, or Lisa? Maybe tell us a little bit about yourself, because you're going to need to be on this health team call too to tell us about what APH is doing in the future.
Yeah, my name is Shweta Arya, and I recently joined American Public Health Association's Climate, Health, and Equity team. I am the Senior Project Manager, Smart Surfaces. So I am working on a project which is spread in 10 cities all around the country, and working with a coalition called Smart Surfaces, which is, their goal is to really help cities transform their urban infrastructure so that it can effectively tackle extreme heat and extreme flooding in urban areas. And we know, due to urban heat island impact, our cities, which has I think it was a surprising figure for me that more than 80% of the US population resides in the urban areas. So we know it's so important to really to really change with times and look at our building infrastructure and then change rapidly to smarter services, which thinking about more reflective roof, reflective pavements, and more passive cooling techniques rather than just banking on air conditioning. So that's kind of the summarizing part. Is there are tactics that we can have cities implement, some passive cooling interventions, so we don't have to depend on air conditioning, which really puts us back in that feedback loop of producing more carbon pollution. So that's that. And I was telling Laurie and Lisa that I don't really have a health background, but I do have a climate organizing background. And I landed on this job because I was very passionate about working in the climate and health space, because I feel like that's powerful, that really moves people, that really connects people's heart and in hearts and minds to really think about why it is important to act on climate. So I feel like it really drives a lay person to pay attention. So it's a really powerful driving force. And I have been working on a couple of initiatives in my last job, and I was based in Delaware, and I was with a I was leading a faith-based environmental nonprofit. So I landed this job, and I really wanted to really join CCL community, and I then learned about the health team and thought, maybe I can join that and see how I can, join the forces and see how we can do what we can do. So I'm here to help brainstorm. I love brainstorming, and I know we are dedicating time in January, but just thinking about where we are and how we can get activated. If we have 400 people in our health team, then how can we double up on our outreach? And Sarah's presentation was just amazing. I was thinking about how do we get to those young people who are studying health, and get them early.
That's so cool. Can I add something to what Shweta says?
Please.
Lori? Yeah, I mean, I love the fact that Shweta has reached out to us, because I think she might be kind of the missing ingredient in some of the work that we're doing. We're all, we're all passionate. We're all out there, doing our thing, and it would be nice to be able to amplify what's happening among us. It really would. And so I'm thrilled that you've come to us to try to spark an idea. And I wanted to tell you guys, and I hadn't even told Lori and Rob this, but you guys might remember that I think his name is Nahil, who came and did a presentation. I wasn't here, but had a template op-ed and had suggested that we push it out. And he had come to me, and Charlotte had come to me on the template, and I had worked with him a little bit. Anyhow, Charlotte called me about it. And you guys may or may not know, but there's a media team on most chapters that Charlotte puts together these template op-eds that they then push out to chapters across the whole country. And so the question was, can we put together a health template? And obviously geographically, the health impacts vary. But one of the things that I was wondering is, many of us have little expertise, like Cynthia and Margie, you guys have that connection between, voting as a social determinant of health. Robin, mental health impacts inside and out. Lori, you've led us on children and health. Bob, you've done some great stuff in terms of temperature and heat. And so, many of us have these different areas that we know. And I wondered if Charlotte had said that she would love us to put together templates and then maybe really market it out, through CCL, to get health professionals of all types, including nurses and other people, who could then take our templates and use them to publish in their local newspapers and get different messaging out. I don't know if that's the kind of idea that you had, Shweta, and how to make that really work or fly, but I had kind of gotten in over my head on that anyhow, and never had spilled my guts about it.
No, I think that's a great idea. There's another person who used to do, I was a silent member of Delaware County team, and there was somebody who would their thing was just to pick up on the opportunities. If there was an article published in a leading newspaper, and somebody can write a response. So they'll have, somebody will just be that watchful person who would just keep an eye and then share in the group and say, hey, this is a great opportunity to write an op-ed. And here are 3-4 templates if you want to use that. So maybe something like that, to maybe send out a reminder in the team, hey, these are some, so maybe a few of us can be those watchful people who can, keep an eye on opportunities to write
Connect the dots. Yeah, that'd be cool.
So I've sent out 3 pleas so far in the last 2 to 3 months because Lisa's does way too many things within CCL besides running the Michigan Clinician for Climate Action Group, and she's trying to step back. I have not had one single response, and I think some of that is because leading the health team sounds like too big of a bite for everybody. So I'll get to you just a second, Robin. So we thought that maybe rather than have people, asking for help leading the health team, that maybe we can look at having different aspects that various people help with. So like what Lisa just mentioned with writing, both getting the word out or just suggesting it to other people, finding people willing, et cetera. And that might be a better way to reorganize our team. I mean, I think Lisa and Rob and I feel very strongly that we need other people involved. We need younger people involved. We need more of everyone involved. And I don't think we're not talking about a huge amount of work for anybody.
I'd forgotten that suggestion, Lori. That's great. And new ideas, right? New ideas.
Robin?
I wasn't jumping out of my seat to talk. I was just nodding in agreement because there seem to be 2 threads here. One, I think Lori has just articulated such a critical one, which I am also facing in my particular organization, of how to spread around and engage a large membership. And most organizations don't have leaders or activists doing the work, but have a groundswell of participation. But how to tap into that meaningfully so that there is new blood, new energy, and engagement that is deeper than those who are at this particular meeting. And so I see this as 2 different threads. Lisa, you mentioned some of the content experts in this room, and I would wonder if Bob and Cynthia and Margie had the same responses I did of Oiga Volt, another thing for me to do. But how then do we capture our content expertise as a way to assist, Lori, as you've said, helping the membership take on smaller tasks that don't feel so overwhelming? And I don't have the answer, but I think that that's incumbent on us to think about the vitality going forward.
Margie, you're muted.
We've been talking about this a lot at Climate Health Now, about how we have over 700 members, but how many people actually show up for meetings or activities? Maybe 50. And so how do you move people from concerned to advocacy and activism? And so we're thinking ways how we can do that. And part of it, I think I've done a lot of new member onboarding, and people are concerned, but they don't know what to do. And so I think part of it's training them with skills about how they can see themselves as activists. And maybe it takes a little training and some workshops for them to see themselves in a different role. And it's also, I think, creating community so they feel supported and that they're part of this community and they feel they have the support and feel the passion of the group and feel like then they can go out and do something. So we're thinking about that a lot, and maybe trying to create some educational programs for our members about how to be advocates, or how to create your personal narrative, and how do we create a story of this whole Marshall Gantz organizing, grassroots organizing principles. So yeah, it's a problem.
Joanne?
I have 3 sort of separate thoughts. One on leadership of this group. Maybe it's worth thinking about having a team of 4 to 5. I could see probably organizing 2 meetings a year. I just don't want to be, I don't want to be the coach lead of one more thing. So that's thought number 1. 2, in terms of activating more health professionals through CCL, I don't think that most group leaders or people that are doing onboarding for our chapters are really aware of the power that health professionals can have in a couple of areas. And most health professionals aren't going to come to regular chapter meetings. I mean, a lot are not, but they could be specifically activated for specific things, like writing a letter to the editor, or like attending a lobby meeting or an event with an MOC. And so maybe it is worth trying to go to one of the group leader calls, or to talk to Ellie Sparks about onboarding, just to say specifically, when you have a health professional join your chapter, here is a set of 2 or 3 things that you can think about, and you need to keep this person on your list and understand who they are so that you can go back and reach out to them for specific things. And then my third thing about what should the CCL health team really be doing, you know, I feel like we should be working on CCL's policy areas specifically. And the 2 things that I think would be easiest in that regard, depending on where we live, one is building electrification and efficiency, and especially with all the health facility and FQHC funding that's coming out right now, for us to know about that and to interface with our chapters on that policy area, I think would be useful. And the other would be forest, especially for people in a place like where I live in the desert Southwest, where urban trees and tree equity are huge, and there's already a huge community and state response that we can tap into and that health professionals can be a part of. So I kind of don't see us as a health team thinking specifically so much about CCL policy, and maybe there's an opportunity for us to do that more.
Fantastic ideas. Thank you, Joanne. We'll just sort of have the juices flow, and you have a 2 minutes left, and maybe tonight, but then just be thinking about over the next couple months, and we'll try and post a thoughtful comment on the forum, and people can comment there too over the next 2 months as we sort of think about this. Thank you, Sarah.
Sarah, I'm so glad you said that. I'm using that in a lecture on Thursday. The Venn diagram. Is it well received?
I think so. Yeah. Oh, I love it.
I do too. That's great.
Thank you.
Thanks to those mental healthy kind of people.
If anybody feels, you know, I know that Ellie and Charlotte very much want to move forward with these templates of op-eds. So if anybody is willing, literally it's just writing an op-ed on a template for an op-ed, or just really writing an op-ed that has some blanks on a topic that you know well that connects climate and health. Let me know, because I do think that that could be a tool to activate people. And I know that Ellie and Charlotte really want to do that in the new year.
So one brief thought is, building on what's been said before, I think there are probably a lot of health professionals in CCL that we don't even know about. And do they know the power of their own voice? So it might be interesting to do a survey of those 400 people. Have they ever written an op-ed? Have they attended a lobby meeting, specifically with the health voice, not with the other CCL message? And would they be interested in doing that if they were provided a template or talking points? And that might help build interest in the kind of workshop that Margie talked about. CCL already has tremendous advocacy, but to let the health people know that they have a special message. I'm curious as to whether everybody knows that. We know it, but can we mobilize more people with that? Because I think it needs to be different than what health people are doing in other organizations. Like, one of the things I love is that most of us are also in the consortium and doing other things, but for CCL, we need CCL type things to do. I agree with Joanne on that.
That's a great idea, doing a survey.
That
So
is a great idea.
someone to tabulate the results of a survey is a pretty simple task. So maybe
but a survey with offering actions, offering things to do, not just, what do you think, but we can provide you this. Would you be interested?
Mhm.
Mhm.
So coming up with a survey tool and then getting it out and then kind of tabulating the results. And other
Yeah,
people can help with it too, but if anybody's interested in helping with that, that's a great idea.
I'm happy to help with that, Lori.
I will let Charlotte and Ellie know that you guys are going to do that. I do know that the whole idea with the op-ed letter to the editor stuff is to actually get it out to the general CCL people and activate the health professionals in the general group. That's to give them a sense that they've accomplished something. But I also agree that focusing on CCL policy, and I also agree that getting chapter leaders and liaisons to think of health professionals to pull them in to lobby meetings makes great sense.
Well, we might be able to do that with the group leaders, saying, do you have health professionals in your group? Would you please try to identify them? And we send them the survey as well. So it could be two-pronged.
Yeah, no, that is a great idea. I think when from the past meetings to elected officials, we always thought about, okay, can we bring a health professional with us? Can we bring a faith leader with us? So maybe having that talk with the leadership is always thinking about, if you're going for a live meeting, is there a health professional you can tap into from our health team or, member or something like that.
Okay, last question, Robin, and then we'll wish everybody Merry Christmas.
I was suggesting the CCL model from the grassroots, that not only should it coming down from the top suggesting find your healthcare professionals, but that maybe this group could put steps together that can be implemented for the membership here to bring it up from the grassroots. It would feel very different to a leader at a CCL chapter if a member came and said, I can talk about this and I want you to know that. Let me bring some of that to you and our group, than it coming from the top. Just my thought.
Yeah, I can see it working both sides, like, we telling the members of health team that these are few things that if you're not already doing, these are the few things you can get activated on, and then have the leadership also encourage all the chapters to utilize their health voices.
Okay, we're 2 minutes over. I appreciate all 16 little boxes here staying on and the people behind them. But let's be thinking about that. We'll get a post out on the forum, and we hope everybody has a lovely rest of their year. And please keep coming with ideas. Email any of us, or like I said, we'll stick it on the forum and people can start commenting.
And Lori and Rob, have a wonderful December.
Yes, and
everybody.
We're so thankful. Thanksgiving, maybe you guys did it before I got on, but I'm so thankful for all of you.
Thank you so much.
Likewise. Thanks for keeping us sane, everybody.
Bye-bye, everybody.
All right.
Thank
Bye.
you, Sarah.
See you in
Thanks
January.
again.